Hi there, Dr. Rajeev Iyer here from IMG Secrets, coming with the experience of mentoring hundreds of international medical graduates like you. In this video, I'm going to tell you 6 ways of how you can become a doctor in Canada without MCCQE1. Let's do this together. Option 1 is my all-time favorite clinical fellowship. Let's say you complete your medical school or college from your home country, and then you do residency or PG from there, and subsequently you can apply for a clinical fellowship in Canada depending on your specialization. For this, you do not need an MCCQE1 examination. How cool is that? The next question is, what happens after you do a fellowship? I have a separate video for that you can check from the description below after you finish watching the other 5 things I'm going to tell you. The second option is through the Provincial Licensure. Now what this means is, let's say you complete your clinical fellowship, for example, and then you get absorbed into the system as a consultant or an attending physician. The university hospital that hires you will now work with that particular province to get you a provincial licensure. For this, you would not need any MCCQE1. And in fact, there have been IMGs who have been successful in getting a full license in Canada through this pathway. Not sure how to go about it? Not a problem. You can always book an appointment with us and we will guide you exactly how to approach your pathway so you become successful through this. Option 3 is the Royal College pathway. Many times IMGs complete their training from approved jurisdiction. The approved jurisdictions in Canada are these countries: Australia, New Zealand, Hong Kong, Singapore, South Africa, Switzerland, UK, and Ireland. Now, many times IMGs from these countries do not have to finish MCCQE1, but rather they can approach the Canadian system through the Royal College pathway. There could be some exceptions. For the most part, MCCQE1 may not be required in these pathways. Making sense so far? So, from a Canadian perspective, it really depends on what part of the world you have had your training from. That can make a big difference. The fourth pathway is what I refer to as a job-based pathway. In this case, what usually happens is an ideal candidate would have finished their medical school or college from their home country. They would have specialized or maybe even super specialized from their home country, and they would have typically quite a few years of experience under their belt. In this case, they can move directly into Canada to obtain a job as a consultant or an attending physician without requiring any exams. In fact, we know of candidates who have been successful through this pathway, even have obtained certification from Royal College of Canada without having to complete these MCCQE1 exams. How cool all this is. You're not going to find any of this online, and we say all this based on our personal experience of seeing these people and speaking to these IMGs one-on-one. In fact, I talked to an IMG who has been successful through this route, who is from India, and this is what he says. I'm reading verbatim from what he has texted me. I was a direct recruitment at a professor level within a university hospital through the academic pathway, so no exams of any type was required. So bottom line, sounds like no exams needed but has an FRCPC. Isn't this fantastic? Now moving on to option 5, this is called an associate physician. This associate physician is in the province of British Columbia. So this technically means an IMG has reached sufficient level to function as a consultant in Canada, but does not fulfill all the credentials. In this regard, they would give him or her a license that is called an associate physician license, which lets them work as a doctor in Canada, but they're supervised by a consultant within Canada. Here is a bit of catch here. The only option of getting away without MCCQE1 is to actually have a USMLE exams. Now, we do speak to IMGs who have actually completed USMLE exams and who are trying to get their position in the US, and these are some of the folks who can actually try an associate physician position in the province of British Columbia. Making sense so far? Option number 6 is to do residency in Canada, applying through the CaRMS residency website. Now remember this, all the provinces require MCCQE1 with one exception, Nova Scotia, that where you can apply for residency without MCCQE1 if you have USMLE steps for this. So the last 2 options I mentioned, you can get away without MCCQE1, but you would require USMLE. But the first 4, no exams required. There are 3 disclosures I want to make. Number 1, None of these pathways are going to be easy. You have to come with a strong application and preferably a mentorship in order to apply for this, either through us or through someone you trust. The second thing is these regulations can change any time, and Canada might decide to add an exam, take out an exam. It's up to them how they want to approach this. And the third thing is, even within these individual categories, some of the candidates may be asked to do MCCQE1 exams. For example, in the job-based pathway, I have two candidates. One of them did not have to take an MCCQ exam, but on the other hand, a different IMG who actually moved from India to be directly a consultant within Canada was asked to take an MCCQ1 exam. So it really depends on the candidate's background and the availability of jobs at the time you're ready to apply. Well, now that you know all these pathways of how to become a doctor without MCCQ1, how about you are a fresh graduate and you decide to apply for residency within Canada? Here is a video where I have provided a beginner's guide for IMGs within Canada. I also have a bunch of videos in the description below that you can check, which can help you be successful with your career. Of course, we understand these things can be confusing for you coming from outside the system. Hence, we have set up a way where you can reach out to us by booking an appointment through our website, either with me or through one of our experts who's going to sit with you, talk to you about your CV, your background, and tell you exactly what you're eligible for and how you can proceed with your application. If you have any questions, you can always post in the comments below. We'll try to get back to you as soon as possible. Take care, stay safe. We will talk to you soon.